Hello everyone, let's continue with our topic-wise MCQ. Today's topic is shockwave therapy. Let's start with some information about this. It's a non-invasive treatment modality used primarily in musculoskeletal condition. It works by delivering focused mechanical energy pulse into tissues which induce microtraumas, stimulate blood flow, promote tissue regeneration, aid in repair of tendon and bone disorders. Clinically, it is widely used to treat chronic tendinopathies such as plantar fasciitis, tennis elbow, and calcific tendinitis. Its therapeutic effects include neovascularization, collagen synthesis, and breakdown of calcific deposits, achieved without surgery. Treatment protocols typically involves multiple sessions spread several days apart with minor transient side effects such as localized pain or bruising. ESWT is considered a safer alternative to surgery with faster recovery time. So let's move to question number 1. What is the primary mechanism of action of shockwave therapy in musculoskeletal tissue? Option A, deep tissue heating. Option B, mechanical stimulation and cavitation. Option C, electrical nerve block. Option D, drug delivery. And the answer is Option B, mechanical stimulation and cavitation. Now let's move to question number 2. Which of the following is a common clinical indication of shockwave therapy? Option A, acute fracture. Option B, peripheral neuropathy. Option C, acute infection. Option D, plantar fasciitis. And the answer is Option D, plantar fasciitis. Now let's move to question number 3. What is the typical energy range used in focused shockwave therapy for musculoskeletal conditions? Option A, 0.08 to 0.28 millijoules per millimeter square. Option B, 0.01 to 0.1 millijoules per millimeter square. Option C, 1 to 10 millijoules per millimeter square. Option D, 10 to 100 millijoules per millimeter square. And the answer is Option A, 0.08 to 0.28 millijoules per millimeter square. Now let's move to question number 4. Which of the following is not a recognized side effect of shockwave therapy? Option A, stimulation of neovascularization. Option B, increased collagen synthesis. Option C, permanent nerve block. Option D, breakdown of calcific deposits. And the answer is Option C, permanent nerve block. Now let's move to question number 5. What is the main advantage of radial shockwave therapy compared to focused shockwave therapy? Option A, greater tissue penetration. Option B, less discomfort and broader area of effect. Option C, higher risk of tissue damage. Option D, used only for bone healing. And the answer is Option B, less discomfort and broad area effect. Now let's move to question number 6. Which of the following is contraindication for shockwave therapy? Option A, chronic tendinopathy. Option B, plantar fasciitis. Option C, over the open wound. Option D, calcific shoulder tendinitis. And the answer is Option C, over open wounds. Now let's move to question number 7. What is the typical session frequency for shockwave therapy in most protocols? Option A, daily. Option B, every 2 to 7 days. Option C, once a month. Option D, only once. And the answer is Option B, every 2 to 7 days. Now let's move to question number 8. Which of the following is a common side effect of shockwave therapy? Option A, systemic toxicity. Option B, permanent skin discolorization. Option C, muscle hypertrophy. Option D, localized pain or bruising. And the answer is Option D, localized pain or bruising. Now let's move to question number 9. What is the main proposed benefit of shockwave therapy in chronic tendinopathies? Option A, immediate pain relief. Option B, stimulation of tissue regeneration and remodeling. Option C, reduction of muscle mass. Option D, permanent loss of function. And the answer is Option B, stimulation of tissue regeneration and remodeling. Now let's move to question number 10. Which parameter is most critical for the effectiveness of shockwave therapy? Option A, energy flux density. Option B, room temperature. Option C, patient age. Option D, skin color. And answer is Option A, energy flux density. Now let's move to question number 11. Which of the following is not an indication for shockwave therapy? Option A, Localized tendinopathy. Option B, lateral epicondylitis. Option C, acute deep vein thrombosis. Option D, calcified shoulder tendinitis. And answer is option C, acute deep vein thrombosis. Now let's move to question number 12. What is the main mechanism by which shockwave therapy helps resolve calcific deposit? Option A, melting the deposits. Option B, blocking nerve conduction. Option C, increasing the blood viscosity. Option D, mechanical fragmentation and cavitation. And the answer is option D, mechanical fragmentation and cavitation. Now let's move to question number 13. Which patient group requires extra caution during shockwave therapy? Option A, young adult. Option B, elderly with impaired sensation. Option C, athletes. Option D, children with muscular hypertrophy. And the answer is option B, elderly with impaired sensation. Now let's move to question number 14. Which of the following is a sign of excessive intensity during shockwave therapy? Option A, mild tingling. Option B, comfortable warmth. Option C, sharp pain or significant bruising. Option D, no sensation. And the answer is option C, sharp pain or significant bruising. Now let's move to question number 15. Which is the key safety step before starting shockwave therapy? Option A, apply over jewelry. Option B, removal of all jewelry and metal objects from the treatment area. Option C, use maximum intensity from the start. Option D, ignore patient feedback. And the answer is option B, remove all jewelry and metal objects from the treatment area. Now let's move to question number 16. What is the main advantage of shockwave therapy over surgery for tendinopathies? Option A, non-invasive, low risk and fast recovery. Option B, immediate cure. Option C, requires anesthesia. Option D, higher complication rate. And the answer is option A, non-invasive, low risk and fast recovery. Now let's move to question number 17. Which of the following is not a benefit of shockwave therapy? Option A, stimulate tissue regeneration. Option B, increase the blood flow. Option C, cause permanent nerve block. Option D, reduce pain. And the answer is option C, cause permanent nerve block. Now let's move to question number 18. What is the recommended post-treatment care after shockwave therapy? Option A, immediate intense exercise. Option B, rest, gradual return to activity. Option C, application of ice pack for 24 hours. Option B, use of topical antibiotics. And the answer is option B, rest and gradual return to activity. Now let's move to question number 19. Which of the following is a contraindication for shockwave therapy? Option A, chronic plantar fasciitis. Option B, over the areas with active infection or tumor. Option C, chronic Localized tendinopathy. Option D, patellar tendinopathy. And the answer is option B, over the area with active infection or tumor. Now let's move to question number 20. Which is the main clinical outcome measured after shockwave therapy for tendinopathy? Option A, increased joint laxity. Option B, decreased bone intensity. Option C, permanent loss of strength. Option D, pain reduction and function improvement. And the answer is option D, pain reduction and functional improvement. So that's all for today. If you have any doubts, please do mention in the comment box. I'll be back with the laser therapy MCQs in the next video. Wait till then. Bye bye.